Hello, my name is Kendria Martin, and today my reading presentation will be How Will the Internet Change Our Health System? So this slide is called the Ultimate Business Knowledge. So the first slide is adoption of EHRs at health organizations. So the article basically states that doctor's office and hospitals adopt systems differently. So, for example, in Houston, we have Texas Children. So, Texas Children probably has a more up-to-date, more standard, more universal health system than a small family practice down the street. The next one also kind of ties into the first bullet point. It says multiple hospital systems. So, for example, at my job, we do billing, and we use a system called Epic. Epic can also be used for billing, scheduling appointments, for reviewing discharge notes, physician notes, also for letting different healthcare employees write multiple notes on it. And then next, it says Clement McDonald's comparison. So in the article, there's a comparison by Clement McDonald's and his colleagues, and it basically just compares EHR adoptions to monkeys being the physicians, and the rainforest. The rainforest is standing for EHR systems, sharing bananas, and the bananas stand for info. And he's basically just stating how it's so flexible to share different informations across the EHR systems when everybody is on the same page and using the same systems. The next slide is barriers to network computing. So the first slide, bullet point says standardized coding. So the challenges with standardized coding is the format for the clinical information. So information systems must recognize and translate different coding systems for different clinical encounters. So one code that may be used at one facility may not be used at another. So that's why ICD-10 is a good reference. The second bullet point is protecting privacy. So that one, the article mentions how patient identification is important while protecting privacy. And then also how it's easy for your private information to get misconstrued when you're trying to move a patient's record to a different file or combine records into a packet, or if you're trying to update a record as far as medical records. The next one is different consumers, different reactions. So the first one is physicians, the hardest sell. So with physicians, they've used the internet and EHR to strengthen their practices, but they're mostly acceptable with younger doctors more than older doctors. Just because of the times that we live in now, most doctors, when they're in med school, they use internet, and then also they use it as far as their learning tools. The second bullet point is consumer applications. So it enables patients to begin the dialogue with the physicians, and also gives the patient a more higher medical knowledge of their disease or their symptoms, and basically to understand and provide leverage to communicate with their doctors and speak on the care process they would desire. The third one is administrative potential. So this one is basically just productivity improvements that are supported by network computing. So basically using the internet has supported in making the patient records more manageable, and then also cutting down on time. And while it's also more expensive than using paper records, it's starting to generate an easier process for all medical personnel. The slide next is issues that you might experience when trying to host patient records online. So of course, licensing. So the internet needs licensing in order to store patient info. For example, a patient portal, you would need some type of licensing to store private health information online. And then the second one is long distance monitoring. So this one is, say for example, you go to a specialty doctor in Dallas, but you live in El Paso. This is so you can monitor your health records while you're long distance and make sure that the privacy of your health records is protected while it's online and you don't have a physical access to it. And the last one is quality information. So while you're reading information online, sometimes the website might not be a trusty site and you might read some information that's false. So that's another point of using internet for healthcare issues. The next one is a quote that I saw on Pinterest that I thought was really interesting to the topic that I'm talking about today. So it basically says that the next generation of healthcare will be decentralized, mobilized, and personalized. Instead of the blunt instruments of the past, we'll be giving patients more precise medications and therapies by Anita Gold. And last but not least, my works cited page. And thank you for your time today. And thank you for listening to my presentation on how the internet changes our health system.